Hello, and welcome to Health Sense. I'm Chris Curl. In a recent survey, nearly 2/3 of women polled said that they alone were responsible for healthcare decisions within their families. But many women don't make their own health a priority. During this half hour, we'll look at some of the most serious, the most common, and the most often overlooked health issues affecting women, including gynecologic cancers, heart disease, and varicose and spider veins. We can't talk about women's health without addressing breast cancer. The chance of a woman having invasive breast cancer sometime during her life is about 1 in 7. And when it comes to women's health, breast cancer is talked about the most. Breast cancer awareness and education have increased over the last few decades. But with so much information out there, some women find it a challenge to separate fact from fiction.
In 2005, approximately 211,000 women will develop breast cancer. When it comes to early stage breast cancer, which is what we're focusing on, the overall survival rate at 5 years is roughly 97%, those are very good statistics.
Experts agree that the key to early diagnosis is early detection, and breast self-exams are an often underused tool.
A lot of women still take it for granted that their doctor will do their examination for them, but what we try to stress to them is we're only going to see them once a year. So the important thing we try to emphasize to our patients is that you continually have to do your monthly breast self-examination. And a lot of women will say, well, I just don't feel anything. I mean, I have all these lumps and bumps. Well, we try to encourage them that they should keep a journal and keep a note as to what they're feeling, and then if they notice any change, then bring it to our attention. That's the most important thing that they can do, is to notice changes in their breast.
One of my coworkers was going through a scare herself. Kind of prompts you to do a self-exam, and I'd found a lump myself. Luckily, she came out okay, and mine was a more serious situation. So
that was 9 months ago. And finding that lump prompted Debbie, an orthopedics charged nurse, to have her first mammogram and a biopsy all in the same day. Her diagnosis? Stage 1 breast cancer.
When you finally find out, it just hits you like a ton of bricks. You walk around in shock. Your mind goes from one extreme to another, thinking that everything's fine, to who's going to take care of my kids and what am I going to do with them?
Debbie eventually had a total mastectomy and reconstructive surgery. Today, she considers herself a survivor and credits the simple act of a breast self-exam with saving her life.
Now I think it's the most important thing. I probably do one every day.
Monthly breast self-exams should be used in combination with annual mammograms.
And what's interesting is that this is actually fairly prominent. It's very important that they do that at a facility that's been accredited with good equipment, good technicians, and obviously credentialed radiologists. And then try to return to the same facility to have their mammogram, because comparison is an important component of mammographic evaluation.
Another key to early detection and diagnosis is knowing and understanding your family history.
When we talk about family history of breast cancer, we usually consider first-degree relatives, so that's going to be your mother, your sister, or your daughter. Ovarian cancer history in the family is also very important, because that will also determine whether we have to evaluate you, the patient, for breast cancer gene mutation, that is the hereditary breast and ovarian cancer syndrome.
Experts warn that while women who have a family history of breast cancer are in a higher risk group, most women who have breast cancer have no family history. The most important action a woman can take is to follow early detection guidelines. The American Cancer Society recommends women in their 20s and 30s should have a clinical breast exam by their doctor at least every 3 years. Starting at age 40, women should have a screening mammogram every year, earlier for women in higher risk groups. And all women should conduct monthly self-breast exams. Dr. McPhee says he hears lists of excuses from women for not doing self-exams or getting mammograms.
They're probably busy taking care of their family and their loved ones. And what we try to emphasize and show them is that if they don't take care of themselves, they won't be around to take care of the ones that they really love.
With so much attention on breast cancer, another serious women's health issue often is overlooked: gynecologic cancers. The American Cancer Society estimates that this year more than 22,000 new cases of ovarian cancer will be diagnosed in the United States. Add to that about 10,000 cases of invasive cervical cancer, as well as tens of thousands of uterine, vaginal, and fallopian cancers. You can see that gynecologic cancers emerge as a serious women's health issue.
Gynecologic or reproductive tract cancer is a very important women's health concern. An important concern of gynecologic cancers, particularly say with ovary cancer, is that although it is much less common than breast cancer, it is more difficult to detect. Women tend to present with more advanced cancer. Certain gynecologic cancers are uncommon, but they account for many more deaths in women.
Daisy, come on. Come sit down. Yes. I had just had all my pap smear and everything, and 2 weeks later I started to feel discomfort. The only way I can really explain it is I felt pregnant. My stomach was bloated and was just something wasn't right, and I knew it.
Like most other women, Pat, who has a family history of breast cancer, had no idea the symptoms she was experiencing were red flags for ovarian cancer.
My mother had breast cancer, but when we did and both of her sisters, so I was always very, conscious that, worried about breast cancer. I was just sure that would be, if I got cancer, that's what it would be. When they said ovarian, I was like, never heard of it.
Ovarian cancer cannot be detected through routine pap tests or exams, and the most common risk factor is a family history of the disease.
The signs and symptoms of ovarian cancer tend to be relatively subtle and quiet. It includes persistent early fullness at mealtime, pelvic or abdominal bloating, unexplained vaginal bleeding.
Because the symptoms often are vague, only about 10% of ovarian cancers are detected in the early stages. Pat's diagnosis? Stage 3 ovarian cancer.
When my family doctor called me and he said, it's ovarian cancer, I can remember my exact words are, I can fight this, can't I? And that's what I've done. I will fight it.
Pat had a complete hysterectomy and started chemotherapy.
This is my Christmas hat, since I had no hair.
And since her initial diagnosis 4 years ago, she's gone in and out of remission 4 times.
Most cases of early ovary cancer can be controlled and even cured with proper surgery and in some cases chemotherapy. Unfortunately, most women with advanced ovary cancer will ultimately suffer a recurrence of their disease.
I look at it actually as a chronic disease right now. It's something I will live with, and it'll be chronic like someone with heart disease. I'll be on medication, possibly chemo the rest of my life.
And Pat's concerns for her family's well-being still come first.
The hardest part of having cancer is telling your family. To me, that has been the hardest part, and to watch them, I'm very confident going through it, but it's hard to tell them. And that has, through it all, that's been the hardest part.
Uterine, or endometrial cancer, is another common cancer concern for women in their menopause years.
It's important for women to understand that any amount of vaginal bleeding after they've gone through menopause is abnormal. 10% of women with postmenopausal bleeding will be found to have endometrial cancer. Most cases of endometrial cancer that are detected early are curable with surgery, and the cure rates are 85% or greater.
Early cervical cancer also is often symptom-free, but unlike ovarian and uterine, cervical cancer can be detected early through regular gynecologic screenings, and the cause of cervical cancer is also more clear-cut.
The main risk factor for cervical cancer is exposure and infection to human papillomavirus. We now recognize that essentially all cases of cervical cancer are related in some form to having been exposed to this virus. It is the most common sexually transmitted disease.